Hi, I'm Laurie Patillo, and today I am going to be talking to you about comparing and contrasting an article on COVID 19, actually, the psychological effects on nurses during COVID 19, because we're in that together right now, and it's very relevant. So, I found an article. It's from January 2020, so they were calling it an epidemic at that point, and it's a pandemic currently, so that may be a little different. So the intro to the article that I found was showing COVID-19 was a new disease and outbreak, and more information and research needs to be gathered on the effects. So I traced that back and found an original article that cited at the present 739 people had close contact with a positive case, including 419 healthcare workers that were quarantined and questioned about their symptoms and the development of those. That was actually from the WHO 2020. And so that explains that the disease is relevant and healthcare workers are going through it. And then the article that I read also explains, I guess I'll call it the current article, explains previous studies have shown unforeseen natural disasters and new diseases that nurses sacrifice their own needs to take care of those people during the epidemic work, and they work harder out of their responsibilities that they feel. They're very selfless, which we know. Then I went back, and the original article from 2014 was showing that nurses take unprecedented roles in disaster settings, and they want to support their patients in any way they can during that time. So that does match up. And then on the current article, the study that they were conducting to find out about nurses' psychological effects during the epidemic, COVID-19, aims to understand subjective experience of the nurses through semi-structured interviews. So they're trying to analyze that data and using phenomenological methods. And I looked back, and the original article had information about the phenomenological method, and it said that it was a descriptive study of human consciousness and experience. But I could not access the full article due to some kind of copywriting information. So I'm not quite certain about that one being legitimate, but it was cited 47 times. So, and they did have 27 other citations included in the article. I just couldn't see the full text. So, moving on. So data was collected for this current article using one-on-one interviews, and they used techniques like unconditional acceptance, active listening, and clarification, and that was promoting authentic data and trying to avoid bias. And interviews were stopped if any emotional problems came up. So that's just a little background on that. Then the current article said that nurses caring for the COVID-19 patients found that they felt tired physically, they were uncomfortable because of the outbreak, they had an intense workload, a large number of patients, lack of protective materials, and that was consistent with studies on the outbreak of the MERS and Ebola. So, looking back, the original study showed that nurses found coping mechanisms to help them through worrying about their family and friends, especially through video calls. And the need for psychiatric services was reinforced in the study. So it's just saying that through traumatizing events, nurses did need some coping mechanisms and some psychiatric evaluations. And then further down in the study, the current study, it's saying that pressure was caused by the epidemic to nurses, but it could be alleviated with psychological adjustments. In this study in particular, nurses started using avoidance, isolation, humor, and breathing exercises. And those were all things that were defense mechanisms used during SARS. And tracing that back, in 2003, those type of coping mechanisms were used by college students in China during SARS. So I know that subject is a little different and different than that of nurses caring for patients, but it did come from a peer-edited article that adds some credibility. But I would question the subjects here since they differ so much. So moving on, the current article found nurses had some positive emotions, which they gradually appeared or simultaneously with the negative emotions as a result of caring for the patients during the outbreak. So this was a contrast to the results from several studies that were the original studies they were looking at, that described only the presence of a large amount of negative emotions during the stress of an outbreak, such as in 2019 when Wuhan, China was going through the first bout of cases, and so much was unknown about it. So in the case of an outbreak, confidence in safety, early training, and confidence in professional skills were the factors that promoted the staff's, healthcare staff's willingness to participate and take care of their patients and feel more supported during that time. And that was done, was found from a case in 2015 with the flu pandemic. That was information from the flu pandemic, 2015. So in conclusion, I find that the article is credible and valid. There were, let me see if I can find, there were 29 citations here. This is the current article, 2020, about COVID-19. So I find it credible. The strengths of the article were drawing conclusions from multiple articles that related to stressful, traumatizing events, such as the flu pandemic in 2015, SARS in 2003, natural disasters, and healthcare workers are resilient, flexible human beings, even when faced with terrible events. And we need to draw on our close friends and those positive coping mechanisms to get through the situation. And I appreciate you viewing this video and hope you have a great day. Thank you.